Hello, my name is Dr. Brian Raid, and I'm a naturopathic doctor, and this is a video about the importance of optimizing blood pressure. Someone posted a question recently on one of my videos asking about how to deal with high blood pressure because I've talked about low blood pressure before, and so I will answer that question, but I thought I'd take the opportunity to talk about low blood pressure again because it's something that I found to be just sometimes pivotally important for patients who are dealing with complex chronic illness, and I just want to talk about that a little bit too. So I'll get to the high blood pressure at the end of the video, but with low blood pressure, there's a number of patients that I've had in practice where once we identify that they actually have problematic issues with low blood pressure, and we start addressing that and building up their blood pressure, then it can sometimes be the most pivotal thing that we do. Well, and sometimes it is the most pivotal thing that we do, or it can be one of the most impactful things that we do. I've had patients who are being treated for mold illness, chronic infections, heavy metal elevation issues. We're supporting their mitochondria comprehensively. Their diet is as pristine as possible. They are doing amygdala retraining or other things to help work on their mental emotional health. They are, exercising appropriately to their body's current needs and functional ability. They're just doing they're doing breathing exercises. They're just everything right, and they're getting better, but it's slow, or they're better, but they've improved significantly, but they've hit a plateau. And I've had a number of patients like that where it wasn't until I became better trained and aware of the impact of some of these blood pressure issues that can be afoot that I then, went back to the case and said, ask some screening questions, or ask them some screening questions and see, oh my goodness, I think you have blood pressure issues. We do this test. It's called the Nasaline Test. And as I'm saying that, I should post a video about that coming up soon. And we find that they have abnormalities on that test. We start treating their low blood pressure, typically with appropriately prescribed and appropriately titrated salt water, sometimes intravenous saline infusions, sometimes some other things, and it can be just a game changer for them when that's what's indicated. So I've had a number of patients to date now say the best thing that you prescribed for me was these therapies to help get my blood pressure on track, and sometimes it's just salt water, which always sounds a little silly to me because we've done lots and lots of other things that are much fancier, and yet that's been one of the most impactful things. So for patients who are struggling with really any symptom, could potentially track back to lower than optimal blood pressure or blood pressure irregularities. But particularly fatigue, brain fog, definitely dizziness, lightheadedness, sometimes pain, sometimes heart palpitation, shortness of breath, certainly impaired exercise or activity tolerance. So those would be some of the most common symptoms that would come up, but there's others that can manifest as well. So just putting out another plug there that if you are suffering from complex chronic illness, it's worth having a chat with your clinician to say, hey, is there maybe something going on with my blood pressure that maybe needs to be addressed? And I will do another video, an addendum to this, probably the next video that I'll make, because I'm very passionate and excited about this topic. So I'll talk about this Nasaline test, which you can read about online. It's NASA, like the space agency, because they actually developed it, not to help people with complex chronic illness, but to help assess their astronauts for some reason. I don't really know much about the space program, etc., but they developed it. It's called the Nasaline test, and it's easy to find information about it online, but possibly talking to your clinician about that if it's, if you're suffering from those symptoms and if it's something that hasn't been brought up. So talking about the opposite end of the spectrum, high blood pressure. What can one do about high blood pressure? So all of the typical stuff that pretty much everyone has heard about and probably knows about, like exercise, diet, lifestyle, etc., not smoking, different things like that. Those are certainly the foundational things that should be considered. I've had many cases to date, though, where they've had just completely inexplicable elevated blood pressure. Like they are lean, they're eating really well, they're exercising regularly, sometimes exercising like to a ridiculous extent, like much more than the average person, and yet they, they're not smoking. Like there's just no reason that they should have elevated blood pressure, and yet they do. And the most common thing, the common thread that I've seen across virtually all of those patients is that when we do testing for heavy metals, we find elevated heavy metals in those patients. And lo and behold, when we start lowering the metals, more often than not, I have seen the blood pressure of those patients start to reduce. So there is documented evidence that heavy metals like cadmium and lead, when they're at toxic levels in the body, so when people have lead poisoning or cadmium poisoning, they definitely can increase a person's blood pressure. Can we extrapolate that to the accumulations of these metals that are more chronic in nature? So kind of this gradual accumulation of metals across a person's lifetime that has then led to them having a buildup in their tissues. Can't necessarily say that toxicity symptoms of metals and gradual accumulation symptoms of metals are necessarily interchangeable or equivalent, but at least clinically there seems to be that common thread, and it's pretty much always been lead accumulation that I've seen in my patients with otherwise inexplicable elevated blood pressure. So it's something that can be troubleshooting can be done to try to figure out why blood pressure is elevated even when all the other factors have been looked at. So I hope that answered the question, and I hope that I've piqued the interest of other folks about maybe lower blood pressure issues, because they can be really, really important to rule out. The more that I look for it, the more I find it in my patients, and it can be really, really valuable to identify. So I will post a follow-up video talking about this in more detail, and I hope that this was of interest. And if there's any questions about this topic or anything else, just post it in the comment section below.